there's probably going to be some people listening to something like this, and they're going to try to diagnose themselves and figure themselves out. What advice would you be giving them?
Well, it goes back to what we said earlier. When you hear the work that we're doing, this is not about diagnosing yourself. If you have an anger issue and you've gone to counseling, you've probably been told it's the alcohol because you alcohol abuse, right? And you get angry, or you have high anxiety, or you have antisocial behavior, or you're manic depressive. That's like a catch-all for anyone, and which is just a fancy way that they can give you a drug. I don't think so. Please don't go looking for a diagnosis. What you're looking for is the actual, like you said with the gentleman. You gave an environment, and that allowed us to see the context in which this was made. Mm-hmm. Right? How the complex was made. And remember that this person probably in other contexts does not jump and get angry. But if he's in front of a male who's suggesting something about him or his character or something he disagrees with, then that is a person that he views as above him. If that is a father, if that constellates a father, then he is now a 5-year-old that has to protect himself, and he's going to do it at all costs because he's no longer 5. He's emotionally 5, but he's got some oomph now because he's in a body that's not 5. And he's got testosterone. So if a 5-year-old had a bull testosterone, can you imagine a 5-year-old in the body of a bull would be terrifying? Voila. This is what you have. So it's cute when they're 2 and they throw a fit. It's not cute when the 2-year-old is in the body of a full-grown man. There's a word called a false positive bias, which means diagnostic overreach. This is very common. It's done all the time in traditional therapy and traditional medicine. And so this isn't just my idea of you don't want to associate with a bunch of bad diagnostic criteria. It's actually in their framework. They understand that this happens all the time, and that it's kind of like a placebo. If you tell someone that they're manic depressive, whether they are or not, they're probably going to be manic depressive now. So I'm not. That's called a false positive bias or diagnostic overreach. It's a thing. Look it up. It's you don't have to be a conspiracy theorist to understand this.
It's interesting you bring that up. I have 2 little things to bring up about that. But I remember when you and I first started discussing these things, particularly in relationship to my own, complexes, you could say. I mean, and one of the very early things that I noticed about the way we were communicating and talking about me as a person is there was this very deep felt sense of being seen, because it was as though you were telling me that my behavior and everything I'm doing makes sense perfectly given what I've been through. And and there was just something about that took the edge off of, and it was a felt sense. You didn't say it explicitly. It was my own instincts knew that I was in front of someone who actually saw me beyond my adaptations, right? And I had, what I could tell is that my complex, in order to survive, had insisted that the world perceive me in a specific way in order for me to be safe. Like I needed to be seen as, whatever. This is silly because we've grown so much beyond this, but it's this idea of me being less than, or, like all these things. And I know this is shared. I know many people feel this way. Yes. So all the while it felt so uncomfortable for me to be seen that way, I also actively participated and insisted unconsciously through my behavior that people do see me that way. I would show up at weird times as smart as I am and just look like a retard. There was just all these things that I would do
Yeah.
unconsciously, you know. So there is something magic about that, where it's like we're given room to breathe and be who we are, and actually, and our symptoms are not so much seen as that, which has just got such this negative connotation. It's just, what's another term? I mean, is symptom the right word? Is it's just more of like an adaptation or something? It's just these, yeah, what would you call them?
When a complex is formed, a malignant complex is formed, let's say a rage complex, it's highly adaptive. It's brilliant. It's a brilliant strategy for someone who completely is underprepared for the situation as being that young and not having the abilities to protect themselves and so forth. And then also the care instinct that wants to connect, right? That needs to connect, that every part of their instinct says, I want them to protect me. So, right, that's working against you if they're actually causing harm. That doesn't turn off. So that's another reason that you have these dissociative qualities. When you get to a certain age, what was adaptive becomes maladaptive. So I don't want to say in the beginning it was maladaptive. I want to say it was adaptive, but it doesn't mean that it's constantly, that your psyche or your soul is constantly trying to put yourself in a situation to finally resolve that problem that you were not able to resolve when you were 3 or 5 or whatever, or newborn. You weren't able to resolve it then, but you can resolve it now. And you don't resolve it because you're superhuman. You resolve it because you allow someone like people like us to hold the space for you, to look in, like you say, to be able to see you as you are, to be able to see that you're not broken, that you're not a monster, or you're not, you know, you are worthy of being seen. And this isn't some esoteric Christian feel-good thing. We inherently as humans have these 7 instincts, and they're very powerful, and they're in mammals anyways. All mammals have these, and they want to connect, and they want to be a part of a group. So this is our birthright. And if we can't access that, then there's something that has stolen it. And I think this is what we're trying to do. We're trying to help people reclaim their birthright, just like we were able to reclaim ours. When you have that, when you've lost it and you reclaim it, you realize how valuable it is, and that's the compassion that the person senses on an instinctual level. This is counterintuitive, but I am making a bold claim. I am saying that cognitive behavioral therapy does not work. For most issues, it does not work. I'm not saying it on certain things it can work, especially if you don't have a complex, and your ego cognition and your emotions know how to talk to one another. It is a feedback. So you can, when that's working appropriately, you can work on the mind, and it can go backwards. It is possible, but not in the context that we're talking about. Having said that, every once in a while I get someone, or someone who's in the profession, who says, I had a therapist that actually I got better with, a cognitive behavioral therapist. And they've done studies on this, that the few therapists that are any good, that study cognitive behavioral therapy, their primary benefits that their clients are getting is from the client-practitioner relationship. It's that compassion. Yeah. They've got studies on this. It's their compassion that's doing it, not the theoretical framework, not the techniques.
Right. Well, and I think you bring up a really important point, which is this idea that the instincts, and we've talked about this before, that the instincts are designed, they're formed around relating to people.
Yeah.
And to ourselves and the world and our mission and all that.
Yes.
But it's about relationship. The emotions have everything to do with relationship. So what I've seen is that a lot of us are trying to, read endless self-help books to try to fix ourselves, which were wounded in early relationships, and we're trying to fix them absent relationship. And if you suggest, well, hey, maybe you should go express your anger to that person that pissed you off, it's like, oh no, fuck that. Like that, it's everything except that. Like never do that, right? It's anything but that. In fact, depending on the person's adaptation, or what we would call, ISA would call their protective ego construct, often they'll have an entire spirituality, worldview, political ideology based on that wound.
They've identified, just like we warn you not to identify with a pathology. The complex can identify with a spiritual movement. It can identify with a cause of protecting the females or the weak. It has no problem identifying with good things as long as you don't deal with the core issue.
Right, and that's so interesting because these soft-bodied, nice guys that I've talked to, their whole religion is kindness, no matter what. And I guess when I talk to these guys, I try to tell them that anger and rage is spiritual.